The following video will demonstrate how to add a patient to your follow-up waiting list on IPM. Please note for this demonstration a training environment is being used. All patients used and shown are training patients. On IPM, click on the patient view icon, then type in the patient's details. For this example, I'm going to use the hospital number F000217 and then click OK. Make sure you are on the correct patient and then right-click on the row. A menu will appear. Click on Waiting List. Any waiting lists the patient is currently on will now appear in this window. This patient isn't on a waiting list, so click Yes to the prompt. Select the relevant option. In this example, we are going to create an outpatient follow-up waiting list, and then click OK. As always, you must link back to the relevant referral. Mr. Hallower has decided he needs to see the patient again for a follow-up appointment, so we will highlight the relevant referral and click OK. A notification has appeared stating the patient has active alerts. On the live system, you would check these. The waiting list window now appears. The linked referral is attached. You will now need to work through the pages entering the relevant information. On a follow-up waiting list, the date on list is the date the decision was made to follow up the patient. This is not the same as the referral date. The clinician and specialty have pulled through from the referral. I will then click on list name. All follow-up waiting lists must start with FU. For this example, I'm going to select FU Derriford Orthopedic. On the Appointments tab, the clinician in charge and specialty should already be recorded. In the clinic field, you then select the clinic code. In the local category field, select the relevant option. This field needs to reflect how much of the booking process has been done so far. I am putting the patient onto the waiting list only, so I will select OP Please Book. Appointment by dates must be included on all follow-up waiting lists. Remember, you can press C to bring up the calendar. For a follow-up waiting list, the clinician will decide when they want to see the patient again. Let's say the clinician has asked to see the patient again in 4 weeks. If the patient needs to be seen again within 4 weeks, this is their appointment by date. Clicking on the Coding tab, all follow-up waiting lists require an RTT code. Next to the Provisional Diagnosis window, I will select the Coding button to add this. In the System field, select RTT Pathway. RTT codes are usually decided by the clinician and will be recorded on the outcome form of the patient's last appointment. The RTT codes range from RTT01 to RTT07. For this example, I will use RTT04. Once the code has been added, click OK. The Booked/Suspend tab is for appointments booking. At this stage, the patient is only being added to the waiting list. We do not want to add any comments at this time, so I will click OK. If a letter needs to be printed, you can select Yes, but for this demonstration, I will click No. The follow-up waiting list has now been created.